You know, as a part of the senior leadership team, I'm really proud to work here in Torbay, and I'm really grateful for the hard work that everyone does in making that difference for the people that we all serve. And you know, there is lots to celebrate here, so I really hope this is a great opportunity for us to really promote that and be proud of everything we do. We've set up a load of pre-meets with members of SLT, and this is seen to be a supportive thing for people. We really want people to be able to be honest, we want people to feel relaxed, we want people to give the best, most truthful account of the things they're really proud of, and also, you know, be very conscious of the things that they feel we are working to improve. So, you know, this is an opportunity to make sure that we get people into the right place before going in to meet the CQC team, but allow people just to feel comfortable with the whole process.
Your voice and the contribution you make when you speak to them will help CQC to triangulate that evidence. So it's really important that you do pull upon all the positive experiences and the good outcomes that have been achieved for the individuals that we are serving.
As a team, I think the best way to prepare is to think about what you do well. So have some thoughts around what you're doing well, but also how do you know that you've done things well? So what was it about your intervention? What was it about the assessment that you undertook or the outcomes that you achieved for someone that you know meant that you did well? So think about the things that went well, but also how do you know that? So what would be your evidence for that? So that's a really good prep for the CQC inspection. So in terms of the second thing, I would say think about what it is that your team can improve on. So we're always on an improvement journey. There's always things we can do differently. As a team, have a thought about what it is that you might want to do in the next 3, 6 months or the next year to improve on some of the outcomes that I've talked around earlier. If you consider those 2 points together, you'll be able to put your best foot forward when you're talking to CQC to celebrate all the good things that you do here in Torbay.
Hi all, I am Sam French, Associate Director for Torbay Adult Social Care. Firstly, I wanted to say a huge thank you. There are lots of competing demands at the moment in adult social care at this time, and your hard work and dedication to those you support is incredible, and it is recognised at every level of the organisation. I've been asked to provide some information to you to support in preparing for our upcoming CQC inspection. So between the 9th and the 11th of September, as you know, CQC will be meeting with many of you in order to gain a greater understanding of how we work, our strengths and areas of improvement. This is a time to really showcase all of what Torbay Adult Social Care has to offer, especially in relation to things like our integrated care arrangements, our strengths-based and outcomes-focused way of working, how we support individuals to wait well within our system, our relationships with partner agencies, including our community and voluntary sector, our responsiveness in view of safeguarding and how we make safeguarding personal, the way in which we support one another, and our learning culture. Some areas of improvement already identified within our self-assessment are areas like improved options in relation to replacement care, improvements within our reablement offer, improved assessments and wait times, and a better choice and control in view of care and support options for individuals. Most importantly, this is a time to showcase all the fantastic work you do day in, day out. I'm so proud of Torbay Adult Social Care, and your passion and integrity shines through at every level, and I have no doubt this will be showcased during our inspection.
So I'm Adele Friend, I'm the Principal Occupational Therapist for Torbay. I've been engaging with you and keeping the OTs informed about our CQC inspection throughout our team meetings, and obviously, as you know, you've had a number of opportunities to attend staff engagement sessions. When I speak with you all, I know that you feel well informed about the CQC visit, and as you well know, I've also kept you updated with any outcomes on what's happening going forward. So today I wanted to use this opportunity to talk to you a bit more about our role as OTs in improving adult social care in Torbay, what we've done so far and what our future plans are. My role is focused on driving excellence and strengths-based practice across our OT services, leading the training and development of our OTs and ensuring that we have robust processes and embedding the learning that we get from audits and complaints. I also advocate for OT needs both locally and regionally, as well as representing Torbay on national policy and practice. So our achievements so far, our team's made significant progress in a number of areas, which we use audit, complaint and incident data such as Datex to drive service improvements. We've been developing and using OT-specific audit tool for record keeping. We complete annual mental capacity audits, and we've just done one of those last week. We deliver training on legal framework for equipment and adaptations. Alongside with Nikki Griffin, we've done some targeted MCA training and work very closely with the Home Improvement Agency and Torbay Council to evaluate the impact of adaptations on people's wellbeing by introducing a wellbeing score. So what are our plans for the future? We have a number of areas that we're working to improve, one of which is developing a risk assessment tool for the OTs, which we're currently piloting, creating a wellbeing measure to evidence OT impact on people. So we've already got that in place for disabled facilities grants, but we're looking at how we can use that more widely. Review and update our OT competency standards, develop a future training needs plan for adult social care OTs, and support to the development of a new practice model.
So I've had the joy, if you like, of being involved in Plymouth City Council's CQC inspection of adult social care in June this year. So having experienced it, my sort of tips would be for commissioners being interviewed is really think about the difference our services make, how we know, what data do we use, what evidence do we use, how do we continue to check and challenge ourselves about whether services are making a difference for people, how we plan, what resources we use, thinking in that strategic space about how do we think about the population that we serve and whether we are doing the right things in the right places at the right time for people.